Hello, and thank you for joining us tonight for our free webinar, Abdominal Palpation and Diagnosis, featuring Dr. Cameron Bishop. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please make sure to use the Questions tab to assure that we see it during the questions and answers, which will be done at the end of the webinar. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. And now for our featured speaker. I'm proud to introduce Dr. Bishop. He has lived and studied in Japan, China, and the United States. He graduated from NIAOM and ACTCM. He teaches Japanese acupuncture and TCM GYN for ATOM and in the PCHS DACH program. He has been practicing and teaching in South Florida for over 20 years. And if you'd like to see his full bio and course offerings, you can always visit his website at askwithin.com. There will be links in your email afterwards to go there. So please join me in welcoming Dr. Cameron Bishop.
Thank you, Jeff. Thank you very much. So welcome to the class. Welcome to Abdominal Palpation and Diagnosis for Acupuncture. On your screen, you have a beautiful picture from Enoshima Island in Japan. It's up in northern Japan, and it is a beautiful island. And the founder of Keidaku Chido, or Meridian Therapy, is buried there. And he founded it 400 or 500 years ago, so it's a nice spot to go visit. I think I wrote an article about it for Acupuncture Today. So this is Abdominal Palpation for Acupuncture. Good evening. Thank you for coming. I'm Cameron Bishop. As Jeff said, I graduated NIAOM with my master's, got my doctorate at ACTCM. I work for Atlantic College of Oriental Medicine. I teach Japanese acupuncture for over 20 years, and also the TCM of gynecology. I also teach for Pacific College of Health Sciences. I am the lead teacher for integrative case management class and integrative pain management class. And I teach at Network of Knowledge, and I have some courses there coming up pretty soon. My website's askwithin.com. So if you would like to see about more classes and everything else, you can see them there. And thank you to my friends and their offices that let me use their offices and their bodies for this show. So I have a few videos in here. I hope you enjoy them. Hope you enjoy this class. It's meant to be very pragmatic. I hope that you get something out of it to make your class be stronger, make your practice be stronger, patient retention longer, all this good stuff, okay? So that's what I'm hoping for. So let's talk about bellies. All right, so we have, broadly, Western and Asian medicine or Eastern medicine look at abdominal diagnosis differently. So Asian medicine tends to look for tendencies of disharmony. It's kind of preventative, also for treatment. Western medicine tends to look for end stage of diseases. They're going to use percussion and tapping and palpation in a set pattern. And they're going to use this to diagnose things like enlarged spleen or enlarged liver, this type of thing, or gross cyst and things like that. So it helps aid them in that. Also sounds and things like that. The osteopaths have something called manual thermal diagnosis, which is putting the hand over to feel heat coming from the belly. And they, of course, will tell you, you may feel heat over REN12, and that could be cancer, or it could be an ulcer, or it could be they just drank some hot coffee. So it's definitely not definitive, but it's something to look at. So also in Western medicine, of course, there's the brain-gut axis and the enteric gut. And there's a lot of research going on with the neural cells, serotonin being produced there, the hormones, bacteria, all that other stuff. So in Chinese medicine or Japanese, the Japanese have adopted in Chinese medicine, it's called Kampo, and they have adopted using herbal, part of their herbal diagnosis is using the abdomen for diagnosis. So Kampo is a whole nother field of Japanese medicine, so it's worth looking into. Another concept in Japanese medicine, or culture, I should say, is harage. And harage is the language of the belly, maybe the stomach art. You can literally read books on that. So some people talk about it being the skills at interpersonal communication, leadership style, and martial arts, it's knowing your opponent's intention, how he's going to attack, this type of thing. Hara is, of course, the word for belly. So, you know, there's an old proverb in Japanese that says, you're an adult at age 20, at age 30, you're capable of, you're human. So at age 20, you're adult, at age 30, you're human, age 40, you're capable of spiritual thought, and at age 80, you're capable of understanding harage. So it's kind of an interesting saying or kotowaza. So abdominal diagnosis or fukushin is what they do in many different styles of Japanese acupuncture and of course Kampo too. So there's many different forms in meridian therapy or monicas, ion pumping cords, in KM style too, Miyawaki's extraordinary vessel or Kike system too. So there's a lot of different forms of it, shiatsu also. So a lot of different forms and a lot of different maps. And kind of the key is if somebody's using a certain abdominal map, don't use a different type of technique. So if they're using zinc and copper needles for this pattern, then use zinc and copper needles. If they're using this technique for that belly, then use it. It's hard to mix and match. So master something before you start playing with it is what I recommend. So let's broaden out a little bit into Asia, if you will. Still, this is just very limited, but in the abdominal acupuncture world, there is the magic turtle, which is an overlay of the turtle. It's a Chinese system. Dave Shipsey has a great book out on it, Abdominal Acupuncture. I really recommend that book. It's a good book to do. It's a whole different system, of course, from what I'm talking about, but it's the magic turtle. There's also a Professor Chi that is umbilical acupuncture. So he's actually doing acupuncture around the rim of the belly button or the navel. And he's basing it on the book of I Ching and trigrams. It's very popular in China. Not a lot of it is in English yet, but it's a very interesting system. So on the abdominal acupuncture side, we talked about Chinese herbal stuff. We talked about the concept of Japanese hara, and we'll talk about meridian therapy styles or keirakuchiro, and we'll talk about shiatsu. And shiatsu, if you don't know, is like acupressure massage. And of course, there's many different systems for that. So what is a healthy abdomen? Well, good question. So a healthy abdomen is neither hard or soft. It's like mochi. Mochi's like rice, right? Or a dumpling. But for us Americans, maybe it's like a sugar donut, okay? So you can press on it, give some give, but it kind of bounces back. So it's elastic without pain, even on deep palpation. So that's what a healthy abdomen should be like. So I was always surprised in Japan. I don't know why I was surprised, maybe because I was 22. They don't see a six-pack abdomen as healthy. They would say you need a little bit of fat, you know, you need a little cheese storage underneath your belly button, and that's good. And my Aikido sensei used to always tell me that. And of course I was 22 and couldn't gain an ounce of weight at that point. So Fukushima is the formal word for abdominal diagnosis. So hara is the informal word, means belly. And you've probably heard this before, harakiri, and Americans would say hara-kiri. So the samurai would cut their belly open. So as a kind of a term, just to cut the belly open. So same word, hara, or belly. So the formal way of saying hara diagnosis or abdominal diagnosis would be Fukushima. So it's the palpation of the abdomen. It's part of the 4 pillars. It's used to help determine the most efficient phase in the meridian therapy. But it's also used in other Japanese systems for how they diagnose. So we'll talk, and actually some systems, not even so much how to diagnose, but how to treat. So there's a lot of variation of how to use it. So I'm going to give you a quick fun thing. It's a short video. So before you palpate, this is a great technique to relax your patient. And it's great for kids. It's great for all ages. If you're, so sometimes people don't like their bellies touched, but this relaxes a patient. Any trick we can do, whether we're doing a little rocking to calm them, or just talking to them, or relating to them, or mirroring their movements, anything like this to get them to drop a couple levels of stress, particularly with a new patient, is very helpful. So this one I learned probably 20 years ago, and it's very effective. So when you do this technique, sometimes you'll hear the stomach release, meaning that it'll start rumbling. And I tell my patients, you know, don't be embarrassed. That's normal. It's a working sign, things like that. It's particularly useful if they're having any abdominal issues, also emotional issues, but great for constipation or diarrhea too. But it's a great technique just to start and ready the belly. So Jeffrey, you ready for that video?
So let's talk about.
Hey, Jeffrey, that's the wrong video.
I'm wearing shorts and no shoes.
Yeah.
So let's talk about posture.
Oops, wrong video.
I'm wearing.
Hey, Cameron. All right, that's the video that's labeled number 1. So which one am I showing?
Let's try 2.
Spreading is the second one.
This technique.
There it is. Thank you, guys.
This is a very useful technique for releasing the abdomen and the viscera. It also prepares the patient for the treatment.
Your microphone during the video playing.
And viscera.
And then remember to unmute it after.
Basically, what we're going to do is on the toes. The technique is called toe spreading. This is a very useful technique for releasing the abdomen and the viscera. It also prepares the patient for the treatment and also opens up the abdomen and viscera. So what we're going to do is on the toes, put some traction towards me. And as I'm doing that, I'm going to spread the toes. Then we do this one, and we do the next one. And we spread the toes. Then we do number 3 and 4, pull and spread the toes. It should be comfortable to the patient. They often report they enjoy this a lot. And sometimes you'll hear their stomach rumble, which is a working sound that their abdomen is releasing. Again, pull the toes towards you and spread them from each other at the same time. Then do the next set, number 2 and number 3. You're not really trying to pop them or make it uncomfortable or anything else like that. It should feel good to the patient. And also, I'm doing it a little quick. You can spend a longer amount of time doing that. So this is the toe spreading technique. It's very useful for releasing the abdomen, prepares the patient for the treatment. It's also good to do before abdominal diagnosis or needling.
My apologies to Jeffrey. That was not his fault. I mislabeled them, so my apologies to Jeffrey. So that's a great technique. I'm always a little bit hesitant to share it with people, but try it. You can also put a hand towel over their feet and do it that way. And so it is a very effective technique, and patients actually will come back and ask for it. But you can actually, if you get a good sense of the pulling and just pull with your whole body very slowly, you can feel the fascial line all the way up to the abdomen, up to the ribs, and you can get a sense of pulling it. So and also you can compare one side to the other. And if you feel like two toes are more not pulling, so let's make up something, the left side, the third and fourth toe are not pulling, then you might realize there's some sciatica along that line or some stagnation along that line or something like that. So it's a fun way to get in touch with the body and stuff. So give it a try. Let me know. So Shisei is important. Shisei is posture. So this is, some people start with their head and go down. Some people start with their feet going up. So this one is with the feet, starting with your feet. Your feet are relaxed. I like to think that the soles of my feet, every pore is opening up and connecting, and your toes are spreading. And some people talk about kidney 1 opening up, or roots coming out of your toes, that type of thing. And you're balancing the ball of your foot with your center of your heel and things like that. Open your ankles, bend your knees just a little bit. Shoulders are not doing the turtle thing. Your hara is open. Your pelvis is in line, this type of thing. And all the way up. And then, of course, opening up your head to the top, all this type of thing. And no tensions in your hands. And you kind of have a smile inside or smile on your face, then soft eyes. And then you can begin the technique. Some other people think of it this way, as starting with their mind, settling the mind, going into Mushin or Zanshin or these different type of ideas, and relaxing the shoulder, opening up the heart, and all the way down to the toes and grounding again. And then when you're palpating, you're actually using the palm of the hands, not the fingertips. So if I was Freddie's gonna help me here, he's a penguin. And you know, you don't come in like this. You land very gently, like a bird on the water. So it makes Freddie very happy. So this is how you land. If you're typewriting with your fingers, it's uncomfortable. So land very comfortably and stuff like that. And Freddie will like that. And your patients will like it. Also, it works really well if you have warm hands too. Unless your patients are menopausal, then they might like your cold hands. So smooth and graceful, and keep your hands floating, which means you don't stop on the belly. We'll show you a video for this. Now there's different ways of thinking of it. Some people will use their left hand or the Oshide, the left hand, to do all the searching for the findings, and the right hand will hold a needle. This way they can immediately needle if they have to. Other people use both hands, and they'll put one hand above the belly, the other hand below, and they'll check both sides. One's below the belly button, one's above, and they will be looking at the big hara and the little hara and comparing. So there's no right or wrong to it as long as it works for you. And the main kind of tip I have there is, if you stop your hands just to stop working, or to stop on an area, your body will start interacting with it. So it's good to keep moving, and then you can sense it all. We'll talk a little bit more about that in a minute. So this is a video on posture, how to do posture. So this is labeled number 1, Jeffrey. My apologies to you. And this is a little bit about posture or Shisei. So this is also in yoga or Tai Chi or Qigong. So whatever works for you, let that do that. And you'll improve your pulse taking, your needling, and your abdominal diagnosis. So I'm ready for that, Jeffrey.
So let's talk about posture or Shisei. I'm wearing shorts and no shoes so you can see what's going on. So proper posture when you're...
Cameron, can you mute yourself really quick?
Big change. So you want the bottoms of your feet grounded, spread your toes out, your kidney 1 open. I sometimes think of every pore of the bottom of my foot just molding, grounding, connecting with the earth energies, and the top of my head opening up to the sky. This may be familiar to you with yoga or Tai Chi or Qigong type of thing. So when we are connecting to the patient, whether we're needling or taking a pulse, we like to do that, and also remain connected throughout the whole treatment, so it becomes one. So you take the pulse, determine what point you're going to do, move to the area, do the point, come back to the pulse, take it, so you continually move like that. Well, some of the things to avoid being a chi choker, is to lean forward on the chi. You can feel the pulse get hard, or being too close to the patient, or your feet are out of alignment, or you crossed your feet, or you're leaning up over. These type of things can lead to choking your chi and the treatment. So don't be a chi choker, and watch your posture.
All right, thank you. So Jeffrey, thank you for that. Chi choker, don't be a chi choker. So, your posture makes a difference. So if you're leaning over or you're ungrounded, it can make a difference. So you might even want to test that out and see what happens and stuff. So whatever posture works for you, just check into that and everything, and you can increase your results. So positioning the patient, we're going to show a little video on this too. But one of the things, I use the Gokhale method. I'm not certified in it, but it was developed by Esther Gokhale. And she is an acupuncturist, and it's a hands-on postural therapy to bring you back to primal alignment, your patient. She's got a really interesting history, but she has something called stretch line. And her stuff is worth looking at. I really enjoy it. So I use it to put the patients into position so that they're ready for abdominal diagnosis. It also drops the patient quicker into the parasympathetic, the relaxation response. It also helps them with the needling. It also helps the patient be more aligned for pulse diagnosis. So traditionally, abdominal diagnosis is done without a leg bolster. However, if your patient's uncomfortable or they have back pain, things like that, we of course don't want to force them to be uncomfortable. So we want them to be comfortable. So if they need it, they need it. Sometimes I will take it out to get a reading for the abdominal diagnosis, and then I'll put it back in while they're sitting with the needles. We talked a little bit about positioning the hands. So again, we want to gently move our hands onto the patient. They're warm, tell our patient what we're doing, and also be careful where we're positioned. And we'll talk about that a little bit in a minute. You can use both hands or one hand, and there's many different things to do like that that are helpful. So this is kind of a hard diagnosis video. That's not Harry Potter, so don't get excited. But this should be the last video, Jeffrey. So let me mute myself.
Let's talk about abdominal diagnosis a little bit. First trick I'd like to tell you about is called the Gokhale method. For stretch line, she calls it, and it's a great way to put your patient into a comfortable position for abdominal diagnosis and also needling. So the first thing we want to do is the patient, you teach them the first time, after that they'll know what to do, but they'll go up on their elbows and then they'll stretch back slowly and lower themselves. And this puts their body into position. So we know their legs are stretched out and this spine is stretched out and they're a better position. Then with abdominal diagnosis, we can use one hand or both hands. One style of thought is to use the left hand while the right hand has a needle in case they need to suddenly needle or something like that. The other idea is to have one hand above and below the belly and to feel the abdomen with both and compare and contrast. Most systems will tell you to go clockwise on the belly. And as we talked about in a previous slide, there's the idea of going different levels. You're feeling the chi, and the chi level is you're feeling like you're touching a piece of Kleenex but not moving it. And the next level is you're engaging the skin into the muscle a little bit. And the deeper blood level is you're going a little bit deeper and feeling the organs and things like that. You're looking for hard spots, soft spots, things like that. So these are some of the basics for abdominal diagnosis.
Thank you, Jeffrey. So to feel we'll talk about layers in a minute, but one of the things I said is to feel the basic layer. It's kind of like you're touching the top of carpet, but barely, not making it move. You're just touching the top fibers, that type of idea. And as you engage the different layers, you're feeling different parts, and we'll go over some slides on that. So again, palpation is a gentle, grounded touch. Be careful with your thumbs being out if you're palpating. Sometimes you'll hit something you don't want to hit. I always tell patients that aren't familiar with abdominal diagnosis or acupuncture what I'm doing, where I'm going, and why. So whether it's a male or female patient, I go below the belly. I'll tell them where I'm going and why. So for example, I just might say something, I'm looking for an acupuncture point here. We connect it with your symptom of X, Y, or Z, and I'm looking for certain things. And if a patient has any discomfort, or you feel kind of like their field's coming up, or they're defensive or anything else like that, you may skip it. But what I sometimes do is put a towel over their lap, and it gives them a better sense of security. But I'm very communicative with my patients of what I'm doing and explaining it all. So your patients and yourself, we're all auditory, kinesthetic, or visual. So the auditory patients are going to be the ones that say, what are you doing? Tell me about that. And they're the ones you have to talk to. They're not satisfied unless you say, well, I'm feeling this belly, and we're looking for acupuncture points that are active that will help your condition. And I'm finding one, so I'm very excited about that. So if we do a good technique on it, you'll start feeling better. So kinesthetic people, they're the ones that touch the same spot you just touched. And you'll say, oh, does it hurt here? And they'll say, yeah, it hurts right here. You mean here? Yeah. And what you have to do is touch them. So does it hurt here? Yeah, it hurts. Okay, here's my needling. Okay, let me touch it again. Does it hurt less? Oh yeah, let me touch it. They're the ones that have to you have to touch a lot, retouch them in the same spot and things like that. So they like the confirmation physically. And also they're often better afterwards with the treatment. They talk with their hands a lot more and stuff like that. Visual people, they need to see what's going on or get a very visual description. They're the ones that love that when you draw out the 5 phases, or you get an anatomy book out and you point to it. They like that. So if you communicate in those ways, they're very happy. So I'm looking for this acupuncture point on my belly, on the belly button. So you point to yourself, and this is what it does. It affects this area over here. They love that. So if you can connect with your patients that way, it's great. And also, it also explains how we interact with our patients too. So they may be talking to us and we're auditory, and we can hear in their voice their chi changing. Or we may be very kinesthetic. I'm very kinesthetic. So palpation based. So you may be stronger with abdominal diagnosis or palpation stuff. Or you may be very visual. Wow, that person's really out of alignment. Or their aura's off. Or their pelvis is rotated. Or the shoulders rotated. So we all have different strengths in those areas. So it's good to see how your patients are and communicate with them. So that's a good thing to do. So this is a shiatsu system. It's Ohashi system. And we're not talking about shiatsu, but just to tell you that there's many shiatsu systems out there, acupressure systems. There's Hadashi, Shiatsu, Ohashi, all kinds of different systems out there that are being done. And they are made for acupressure systems. So this is Kodo Fukushima's Hara diagnosis, and he's the founder of the East Asian Meridian Therapy Medical Society. And he had the idea of the big and little hara, and these are his different reflexes. And this was his system. And his, we'll show another one, I think, in a minute from one of his disciples and so forth. This is a 5-phase hara diagnosis system. The red is the heart, the earth is the brown, and the lungs are across, the liver goes across, and the kidney is at the bottom. So these correspond with the Ren points and other points like that, roughly. So throughout the abdomen, you can feel deficiency and excess of the qi and blood through the layers. So you're palpating anterior, the surface of skin, posterior to the spine. Each layer needs to be fueled or released to treat the total person. These layers can be correlated to pain and disease, whether emotional or physical. Some will say spiritual also. So when you're palpating, the very surface is the surface qi. Some people put different layers. I just broadly say 3, but I've heard people say 17 layers. So there could be all kinds of different layers from the top to the bottom, and your ability to palpate. So there's a surface qi, the wei qi, the qi of the organs and the moving blood. And then there's the organ qi deeper, and then the blood qi, the deeper blood qi. So these are kind of the broad different areas to look at. On the surface and the qi and area, you're looking at the main phases and things like that. And these are broad generalizations, of course. So this is another way of looking at it: surface qi, qi and blood level, and then the organ and blood level from the skin all the way down. And sometimes when you're palpating, when you palpate the surface, like I said, you might be, some people talk about a Kleenex being on a table and you're touching the Kleenex, but you're not moving it. And the next layer, you're engaging the skin to the top of the muscles roughly. And then the next layer, you're kind of engaging the muscles into the layer below that, into the organs. So these are all the kind of different areas you're feeling at. So very, sinking your hand in very calmly. So there's the concept of oketsu. So oketsu is a broad concept in Japan. So there's a lot of different ideas about oketsu. So literally the word can mean impure blood, but it could also mean blood stagnation, things like that. And there can be degrees of oketsu. So the concept, some people will say oketsu is only found in one spot on the abdomen. Other people will say it could be found anywhere on the body, head to toes. It could be in your feet, it could be in your brain, it could be in your arms, it could be anywhere. Some people will say that oketsu leads to more serious things and will lead to possibly cancer. Other people will disagree with that. So there's a lot of different ideas, a lot of different writings in Japan about oketsu and what it is. So one of the broad ones is the oketsu reaction area, which is in many styles. And it's roughly on the left side, stomach 25 to 28. Sometimes you feel this in menopause, and you can actually use it as a predictor to avoid menopause, in the sense that somebody's perimenopausal and you feel this area starting to get oketsu or harder than the rest of the area, and you do some techniques to release it, you can make their menopause easier or symptomless, depending on the situation. So it can be a predictor. Also in that area, if you have a good anatomy course and you can palpate the ascending, transverse, and descending colon, particularly the descending colon, and you can palpate along there, you can start to feel kind of like gunky areas and keep that from flowing, keep it flowing. So I've done that with a lot of diverticulitis patients. So I can feel they're starting to gunk up. And I had one guy, I would feel it. I said, "You've been cheating on your diet, haven't you?" And he goes, yeah. I said, "We're both scared of your wife. So you need to eat right, because I don't want to get in trouble and you don't want to get in trouble with your wife." And he'd go, "Okay, I'll eat right this week." And he'd come back next week and I'd feel, and it's like, "Oh, much better. You were eating good." So you can use it as a preventative and diagnostic, and also for treatment. So this can go for, most abdominal conditions. Another big area is along the pubic bone, Ren 2 area, Ren 2 and 3, but particularly Ren 2 and the kidney points on each side of it. you can start to feel hardness in that area. We call it kori, and kind of a lumps form or kind of a hardness that's different from the other areas. And if you soften those areas, symptoms can improve. So this you can see with for infertility cases, of course, and also men with their prostate. And just like the menopause, the stomach 28 area roughly on the left, you can use the REN2 on men for the same type of thing. Also, I had one patient come in and he was diagnosed with a rare prostate cancer, and they didn't know, really they had no answers for him how it would progress or if it would progress. And so he came to me. They really didn't know what to do with him, chemo or anything else. They didn't have any research for his particular condition. But that whole REN2 to REN6 was highly deficient, and it was hard at REN2. And he was a guy, but he was very mechanically minded. And I explained to him what I found and what I would do, and I couldn't guarantee anything. But I had no other ideas. So we started doing moxa, Chinetsky cone moxa on his lower belly, and we started doing that Hara point, the Hara point, REN2. And over time, he did really well. And the cancer never progressed the last time I heard. And that's been a few years. So it's been kind of interesting. So I'm not claiming anything, but tonifying what's deficient and moving what's excess is not always a bad road to go. So that's Oketsu in a nutshell. You can write books on it. There's a lot of different ideas. Different styles have different ideas and things like that. But that's Oketsu in the belly. So how do we find deficiency and excess? So it's called Kyoin Jitsu. So when we're feeling the belly, again, we're looking for deficient signs and excess signs in those areas. So if it's the kidney area or the liver area, we're looking for these types of signs, and we want to see them improve after the treatment, whatever we do. So for the deficient signs on the belly, there's going to be less color, less shine, less liveliness, dullness. All this is going to be compared to the surrounding areas. There's going to be depressions, pits, possibly wrinkles, possibly flaccid skin. That area might be cool to touch, cool to cold compared to the rest of the surface, or it might be more reacting to the heat of your hand. I sometimes feel like a pulling sensation when it's deficient, like they kind of want to take a little out of me or something. I keep my hand very neutral. Patients may relax more with the palpation, and the breathing may deepen and improve. And actually those findings of first 3 bullets may improve. So skin often improves with the palpation. So look for the color, shine, shape, and tightness to become less flaccid, to improve. This also happens after you do a good treatment, no matter what practice you're styling. You want to see these things get better. So if we lined up a patient, or we had a patient and we had 10 people palpate the abdomen, at the end, the belly's always better because we have 10 healers, touching the belly. Excess signs or jitsu, or more off color from the rest of the areas, lacks luster, tends to be less liveliness. If you have, you're looking in the kidney area, and you're looking, you might want to see if the colors are the control cycle. That's a little more concerning than if you have kind of off colors in the actual meridian color. Other things you look for is protrusions, bumps, surface tension, and a look of fullness on the surface. Also, you can feel kind of a feeling of being stuck, static, non-engagement with resistance in your hand or on when you're engaging with the tissue. It might be warmer or hot compared to the rest of the surface. Patient may be more on guard with palpation. And also, you can always look at the face, see if they're making faces when you palpate. And the breathing and skin may improve or not with the palpation. So abdominal skin tone, here's some overgeneralizations. Jiggly skin is water retention. Firm folds or adipose. Flaccid and wrinkle can be chi and or blood deficiency. It also could be weight loss. Swollen or bloated can be spleen chi deficiency. More swollen and cold could be spleen yang deficiency. Overly tight can be liver chi stagnation. But most importantly, it's great to look at the Shen. So the Shen can be seen anywhere, head to toes, but is most commonly seen in the eyes, right? So behind the color behind the eyes. So that's how you see the Shen. But you can see it in the tongue, you can feel it in the pulse, you can see it in the belly, and you can feel it in the belly. So it's always important to kind of tune in to what their Shen is feeling before, after, and during the treatment. So you can get a rough idea of what's going on with the posture and the abdomen. Knowing the patient's posture is important. So if there's an anterior pelvic tilt, sometimes this causes the gut to sag more. These are the patients, the heavier it get, the more their feet become everted. But when they're on the table, they might have more of a sagging gut, and they may have more everted feet going out like this. If also they might have odd folds also while on their belly. If their pelvis is rotated, possibly one foot's out and one foot's in. So that could show that whatever this is, my right hand, be the right hip is rotated out, or the femur is rotated. So this is something to look at. Sometimes after the treatment, it'll be even. A rough guide is if you're looking at Ren 8 to Ren 15, if it's a straight line, then it often is good, but if it's off, it implies a thoracic tilt. And Ren 2, the Ren 8 can imply hip rotation, or the folds can imply it. So pelvic tilt and adjustment's always important for OBGYN, also for, of course, birthing, but also it's important for fertility and so forth. So this is a little bit on pelvic tilt and pregnancy. So an anterior pelvic tilt, the body reads a forward pelvic tilt as ready for birth. Before pregnancy, adjust with exercises, put into the neutral position. And the pelvis will move more anterior, especially after 33 weeks. And there's qualified people, there's pelvic floor specialists in physical therapy, they're certified, you can use them. There's all kinds of other different massage specialists, but make sure they're certified. The posterior tilt was probably with them before pregnancy, and they often have more prolonged birth, longer labor, and more pain. And so if you get them into a specialist, these exercises can help prevent prolonged labor, prolonged birth, and an unnecessary C-section. Both tilts are better with specific therapies, specific exercises. Both are worse with the severity of the tilt. So sometimes you can spot this, of course, them standing, but you can also spot it and watch it shift as you're doing treatments while they're on the table. And of course, this is not a back class, but you can spot all this from the rear. And the best way, of course, is to take pictures of the patients before and after standing and so forth. So how do we put all this in your practice? So this, first observe the Shen. You can observe the Shen in the body. You can look for the changes, look for the patterns in the belly, the broad areas for the kidney, the liver, all these type of things. So you can look at these before, during, and after the treatment. You can also really, some people will look after each needle. Wow, that spleen area on the belly is really deficient, or so I'm going to try spleen 3, spleen 4, 6, whatever. Maybe it's a little swollen. I'll do spleen 9, and then see if it's 30 seconds to a couple minutes later, is it softer, or did the chi come into the area? So that's something to look for. Also, you don't want to tell the patient, but always watch their abdominal breathing. It'll change during the treatment. I translated once in Japan for a blind acupuncturist, and there was a camera on the patient's belly button. and the sample patient, or and he would do a point, and I know he wasn't making things up because I was the translator, and he would do a point on the foot, and he'd say, "This is a good point." And the belly would become a beautiful color, the breathing would be good, and the belly button would actually become round. And then he would say, don't do this. This is a bad treatment. And the breathing would go off, the belly button would become misshapen and things like that. So watch for that. Watch the abdominal breathing, the shape, the color of the belly, all this type of stuff, the facial shin, things like that. And fill these abdominal findings before and after your treatment. Also improve your patient positioning, the Gokuli method or anything. You can train your patients to do that. So the next time they come in, they know how to do it. They can actually go to sleep in that position, and they'll often sleep better. You'll get faster, better results. You could also try something like Traeger rocking. Tuina has rocking too, where you kind of shake the patient and move their feet a little bit or their hips. And that mimics being in the womb. So it does bring people into relaxation. Improve your own posture or your shisei. Watch, ground your feet, breathe before you come in, and listen to your own hara. Now, there's a lot of research on Chinese abdominal acupuncture, and more research is coming out on abdominal acupuncture, the turtle system, and how it's effective. There's not much double-blind studies in Japanese acupuncture research. There's almost none. And most of their research is case studies. So it's a whole different kind of thing. So last, I think, how do you get into your hara? How do you do it? So, really you become quiet and still for a while, and you just become connected. And you might start thinking about something you really like. Maybe like your favorite penguin, and your blanket, or hot chocolate, or something you really like and enjoy, or holding a baby or something like that, and feel that feeling throughout your body. And then connect that feeling, and then start watching your patient's pulse or belly or tongue or whatever, and watch it as like you're watching nature. So whether it's water going by or whatever else that works for you in imaging. And then just listen what comes to you in the wind, and not what you're thinking. Is this deficient? Is this excess? Is this cold? Is this hot? But what kind of comes to you? And that, wait 30 seconds. Let all that mental stuff go by. And then just observe some more. You're observing nature. What do I see here? How's all this going? So you just, that's a good way to get in touch with your hara. And then think about how, whatever makes you feel good, like a warm penguin or a baby or a warm chocolate chip cookie, something like that. And this felt sense of that warm cookie or whatever else. And then see if you can connect that to your patient, if it'll resonate with your patient. And just wait 30 seconds. Don't think about it. And this is when healing comes and things like that. So this is a good way to get in touch with your hara, to get in touch with other haras, so we can have better healing and better patient retention, better results, and we can spread healing one hara at a time, if you will. So I think this is thank you. This is my famous bear from Instagram, and I have some classes with Network of Knowledge. I help teach with Ocean Breeze Hara Society. My website's askwithin.com. And my email's cameron@askwithin.com. My Instagram, if you like my photography, is Cameron Loves Life. And my acupuncture Instagram is Askwithin Acupuncture. And my famous bear is Bearable Life. So if you want to follow him on Instagram, he's a lot of fun too. So thank you very much. And Jeffrey, I am ready for questions. And thank you for your patience with me.
Oh my gosh, thank you so much. That was such an incredible webinar, and we do have a bunch of questions here, so I won't take too much time gushing about it. So let's get right in. So the first question is, I thought hara refers specifically to the lower abdomen.
No, it's the whole belly. No.
And then next question, to confirm from the beginning of your presentation, you can use the toe spreading as a treatment for constipation and diarrhea?
Yeah, it's really helpful for moving the bowels, but yeah, you can definitely use it for that. Yeah.
And then when talking about toe spreading in fascia lines, is this the same as the sinew channels? Meaning, can we use sinew channel maps for finding tension or stagnation?
Ooh, that's a good question. I don't know, but give it a try and let me know. Okay.
All right, Charles, try it out. Next question, moving right along. Does it matter to which side of the patient you stand when doing abdominal palpation?
So yeah, that's a funny story. We were kind of taught to always stand on the left side of the patient, and we had great discussions in America why. And people had all these ideas of, the energy of the earth goes this way, or, all this kind of stuff. And, but basically, a lot of it was done by blind acupuncturists. And I finally asked them, and they said, we start on the left side because we all know where to line up then. So that was a very practical reason. However, use either side works. And whatever, works for you. If you're left-handed, right-handed, I use both sides. It just depends. I tend to be on the left side just out of habit.
The next question is about how do you release the point for menopause?
So there's a lot of different ideas. For the Oketsu, some systems will say use lung 5 and liver 4. That's one idea. Some people will use a local point. So they'll use a local point. There's a few people who will use Shidaku if it's more stagnant and there's heat. So Shidaku is micro bleeding on a Jingwell point on the toes. So they might use a stomach, was it 45's Jingwell point? And also on the Jingwell points. So if this is a toe, if you will, it could be here, but you could search anywhere or even the tip of the toe. So if this is a toe, pretend his face is the nail. Well, that's not very good either. You can go anywhere below the nail, above it, or on top of the toe too. And you look for a tender spot, or you look for a raised spot, or you look for a spot that's discolored, and for microbleeding to release that area. And other people, it's just any system, like they'll use yin yang. So lung 7, kidney 6, open up the Ren. And then triple burner 5 and gallbladder 41 for the dye. Other people might use Li4 and stomach 44 or 43 and just palpate that stomach toe. Start with the web, the Bafang point on the stomach, and then start palpating up an inch or so and whatever is the most tender point to release that area. So there's a lot of different ways to do it from many different styles.
All righty, moving right along. Next question. What are your dietary recommendations for patients with diverticular disease? Please discuss acute versus post-acute.
Wow, beer and pizza, pretty much, yeah. I don't do very much dietary at all. One of the reasons is I'm in Florida and they don't listen anyways. So, but they usually already know when they come in. They're already diagnosed and they already know that type of thing. So that's not my strength, dietary stuff. But teaching case management, there's a lot of really smart acupuncturists using that for sure.
And the practitioner who asked the question is one of them. She uses a lot of dietary recommendations and she's taught webinars for us before. So
yeah.
And then next question is going to be kind of it's going to have a two-parter. So how does excess skin from past pregnancy or significant weight loss skew or affect abdominal diagnosis? And then what can we do to improve it?
Oh, fun question. So if there was weight loss, you just want to note that that's part of the picture, and also excess from pregnancy. But still, you're thinking about, is the qi and blood deficient? During the birth process, the labor, did they expend a lot of qi, lose a lot of blood? So part of building up the the qi and blood will help that get stronger. There are other ideas of local points to build up and moxa, direct moxa, to build up the area to make the skin tighter. So there's definitely ideas like that. And depending on how much weight loss is done, whether it's normal or artificial, if you will, meaning by surgery, where they lose a lot, sometimes, you can help it along the way, but, sometimes there's so many flabs of they've lost so much weight, sometimes they need a surgical consult or just live with it. It just depends.
Do you have any beginner book recommendations for someone just getting into abdominal palpation?
Gosh, that's a good question. Abdominal diagnosis, the best thing is to hang out with people. I really like the Hari Society, which is Culia.net, Culia.net. So they have a lot of good classes on that. So I don't think anyone has a book out per se on Hara diagnosis. One of the things with the Keiraku Chidos or meridian therapies, there's so many in Japan. There's, scores of different styles. You can't really say it's this or that. But one of the things is it's very hands-on. And it's very hands-on, and it's just one of those things you have to do with other people. But on your own, you just start palpating and see what you do. And if you feel nothing, that's fine. Look again afterwards, and then just do this for a month, and you're going to start picking up things.
And we do actually carry a book on Hara diagnosis, which I believe was I think it was written by Kiko Matsumoto and maybe Stephen Birch, if I'm correct.
Yeah,
it's called Hara Diagnosis by the Sea.
Okay, yeah, that's for using Monica system.
I believe so, and it's also, from what I understand, not a beginner book.
Right.
I think it's a very advanced book, if I'm correct.
Yeah, and the Monica system he was a medical doctor, and he was probably a genius in the day, and he was a Japanese surgeon, and he developed kind of a idea that you would palpate the belly. He doesn't do pulses. It's not TCM. He doesn't really believe in meridians, but he did use the abdomen for findings along with the mu points to determine which extraordinary vessel patterns to use. And then he would connect the ion pumping cords to that. So he's passed away a long time ago. And there's all kinds of other variations of that have evolved out of that. So that's a whole nother system, Monica system, than Keiraku Chido or a Japanese meridian therapy system. There's no right or wrong, they're just different.
Perfect. What techniques do you use to assess the Shen?
I studied a lot of Lillian Pearl Bridges stuff where I just observed the Shen in the eyes. And one of the things I look for is the Japanese call it suya. And suya means when you take silver and polish it and it gets a shine. So you're looking for that shine. One of the other ways to is just to look at people that don't have Shen, and sometimes I look at mug shots, and you can really see. Don't do it before you go to sleep, but you can see all kinds of different Shens and so forth. So that's a good way to look, and it's the color behind the eyes, and it's kind of that type of thing. That's what I look at. That's what I pretty much do.
And then do you have any recommendations for an overdue pregnancy and mother is not dilating?
Oh, wow. That's a pretty broad question. Get some acupuncture. Yeah, you need to go to somebody that it is a specialty. And there are some great acupuncturists out there that are combining that type of stuff. Sometimes if it's a first birth, the best thing you can do is just really relax them. Just a lot of Shenmen, sympathetic, relaxation type of things so that they can begin to let go, if you will. So sometimes that's one of the deals. One of the most important things, particularly if it's the first time.
All right, well, Tamara wanted to tell you that was great information today, but also wondering about charting this and what are the details or sequence of details to record for the treatment plan?
Oh, that's a good question. It depends on which map you're going to use. And basically for charting, I would chart what's deficient and what's excess, and I'd put a circle where it's deficient and X is where it's excess. What I don't know is, now that we have electronic billing, I don't know if electronic billing and stuff, if there's charts for that or not. Some people will draw their own picture of the hara, and then they laminate it, and then they have a marker that has that you can wipe off, and then they take a picture of it and put it in the objective section in the electronic charting.
Sounds good. And then just to let you know, we have a ton of questions coming in. Every time I look, there's like 5 new ones. How are you feeling on time?
Okay.
Okay. All right. So let's keep going through. Next question. Do you have any specific suggestions for working with women after a C-section?
Oh, yeah. Good question. Yeah. What we do is we look at the scar, and after the scar is healed, moxa. So if there's excess places, you can release it by putting a little baby needle there. If there's deficient area, I use moxa. But after a C-section, moxa, 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 because sometimes there's a lot of cold invasion too. So you really want to build up the lower belly there, for sure.
Do you have specific moxa that you suggest for that?
Well, I did a moxa class for Lhasa MS, and Network of Knowledge, I have a big class, 3-hour class on moxa that's coming out soon. But I use Chinetsku, which is cone moxa, and I use Wakakusa moxa from Lhasa MS. And I make cones with that, and that's what I use. And you can use, the moxa cigars, they stink, but the Lhasa MS actually has a better quality one. I think it's a Korean one. They're smaller, and they smell a lot better. Also, the chimneys or the push-on moxas, you can also put those on. Now, I'm a little lazy, so I like clumps of moxa, and I put them on the belly and strengthen. But moxa, moxa, moxa.
All right. Let's get to the next question here. Let's see. We have a lot of them. Not sure if this was addressed, but at what age is abdominal palpation most effective? As in, can it be helpful for pediatric cases?
Oh, very much so. Yeah, when, kids don't have formed meridians really. So, you kind of can get an idea with the pulse, but the abdomen is actually much more diagnostic. And just some of the broad areas. So if you're going to look for spleen stuff, you're kind of feeling the spleen meridian from, spleen 2 to 6, just to see what's going on. The liver, you're not looking at one point, you're looking at areas. And then on the belly, the same thing. You're looking for deficient and excess, and also watching how the baby reacts. And if the baby doesn't like being put on its belly, then have mom hold the baby, and you can do a little palpation and things like that. So it's a different animal, but yeah, it absolutely works great on babies.
Which abdominal map do you use in your clinic?
I use the Hari system, and I use the one that we showed a couple times where it has the lines going across.
Okay. Do you mind if we go back to that slide just to show it to them?
No. Do you want me to do that, or?
Do you mind?
Nope.
Awesome. So we can just put it up there. Maybe they can. So everybody does have a link to these slides in the email that they received before the webinar. They'll also have another link in the email that they get after the webinar as well. Okay. And then when talking about toe spreading, is there any meaning when a patient's middle toe is on top of the second toe all the time?
Well, I don't know, the Japanese are famous for saying this means that, but they say it's stomach excess, but it might be just wearing the wrong shoes for their whole life. I had a buddy in high school that had that, and his doctor made him go barefoot all summer long. That was the treatment. Of course, this was, well, let's not mention how many years ago it was. And I just remember that, and sure, at the end of the summer, it was more normal and stuff.
All right, let's see. Does the presence of umbilical hernia after HARA diagnosis finding reliability?
Oh, I'm not sure what that means.
Does presence of umbilical hernia alter HARA diagnosis finding reliability?
Oh,
Sorry, I read it wrong.
okay. I guess you just factor that in. I think of it more as a deficiency, right? That's what I generally think about it as. I don't really factor that in too much or think too much about that. Maybe I should.
All right, and then can you actually put up the diagram that was given earlier regarding the organ diagnostic areas with the heart, lung, liver, etc.?
Oh, isn't that the one we have up?
Is that the one? Okay.
Yeah.
All right. Well, so multiple people really like this chart.
Yeah, that's another version of it.
Perfect. All righty. And then would you needle areas on the belly which are hard, and what is needled?
So, yeah, there's techniques, there's Kori techniques. So basically that, and we could do a whole nother seminar on that in the fall, Jeffrey. So is basically that we find the area that's hard, and there's a lot of different thoughts. One is to strengthen the area around it, and that can dissolve it. Another idea is to put a needle in and bring it in till you touch the area. And some people let the needle just melt the area and then wait 30 seconds or something, let it soften and keep moving it in. You can do this any part of the body, bottom of the foot, the calves, the legs, of course, all through the back, the wachawajis, trigger points anywhere on the back, but of course, at the abdomen too. So another technique is some people will advance the needle and do very slight manipulation or the chi intent of breaking the area down. So that's another idea. So there's, more than one ways to skin a cat, and there's no right or wrong, I really think, in the end. But that's some of the ideas they have for that. Also, if it's very hard, you could use Kyutoshin, which is needle on the head of the moxa. That's another good technique to really get it moving too.
What is your opinion about needling under a scar or into a scar? And then what about derma rolling on a healed scar?
I don't know a lot about derma rolling. I think I was given one by Michelle Jealous, and it worked really well. I used it on myself, and that was fun. That's all I know about it. But needling above or below a scar, I look at more what's deficient and excess. And I start trying to soften the scar by bringing the deficiency, getting rid of the deficiency, if you will. And that's what I do. So that's what I think of with that. And then I do that for a few times. It also depends on how old the scar is. But what I generally find is the chi is leaking from scars, and I start plugging these, and it gets better and better. And then sometimes one spot will linger after 1 or 2 treatments, and we get rid of that. And then we start thinking about softening. And then after that, the scars are much better. So that's kind of what I think of it. I don't know if that's sophisticated or not.
All righty, let's see. How do we know if Ren 2 and Ren 8 are on the same line or off?
So it's basically, if you look at this chart right here on the screen and you're thinking, Ren 14, 15 are at the top of the red, and Ren 8 might be somewhere in the brown. Let's just pretend it's at the bottom of the brown. And then you're just seeing, is that line straight? So is that line straight up and down, or is it going at an angle? So this kind of implies thoracic tilt. It's not definitive, okay, not at all, but it's something to look at, particularly if you have a patient coming in with back pain. And also it's something you might want to look at, that band on the Ren channel and the kidney channel, if the back pain isn't resolving on the opposite area. So you're getting the front and the back. So that's kind of one of the things you keep in the back of your mind. And same with the REN8 to REN2 if it's off.
All right. We have 3 more questions, and then we'll be done. Next question, which abdominal system do you use? Fukushima?
No, I'm using the Hari system. So a lot of the Hari system was developed by Koei Kuwahara, and he studied under Fukushima's system for 7 years, and he kind of developed it to another level. So all of that was based out of the Nanjing. So there's all kinds, if we start, Googling Fukushin in Japanese, you're going to start seeing all kinds, you'll go crazy with information. But basically, I'm kind of using that rough system from the Hari system.
Next question, I have a guess, is from either a friend or student of yours. Cam, how much moxa will you use and with which technique thread moxa for someone who is Qi and or blood deficient? In which point usually?
Well, the obvious, is stomach 36, spleen 6, spleen 10, things like that for blood deficient patients, and a point around large intestine 10. That's kind of like this textbook type of points that we use. But you can get more specific if they're liver blood deficient and do liver 3 or liver 5 or something like that.
Okay, and we have
also the back shoe points, of course.
Back shoe points.
Yeah, anything that's deficient along there will tonify the blood.
Okay, we have one more question left, and that question is, could you speak to tenderness in the right and left subcostal regions? I ask because some systems say SP and some say LV.
Oh, yeah. So which side is which side? Yeah, that's a good question. There's some systems, of course, will say the right is the liver and the left is the spleen because that's where the organs are. And I never really think that way. I'm looking at the liver, with 5 phases, if it's all deficient between the belly button and above, it's usually a lung phase or a spleen phase. And if it's always like mostly deficient or strongly deficient, the belly button down to the pubic bone, then it's probably a liver or kidney phase. It's a little bit shotgunny, but generally that's kind of true. So that's how I think of it. And with that.
Well, that is all of our questions for tonight. We cannot thank you enough. I know everybody in attendance, I can see all of the big thanks and all of the appreciation and all of the emojis. It was just really, really incredible information. Just to let everybody know, in the next maybe 2 to 3 weeks, we will have 2 courses from Dr. Bishop that will be up and available for sale through Net of Knowledge at lassaoms.com. We're very excited about it. We're also working with Dr. Bishop to schedule something for in this fall. So stay tuned for another class from him. Our next free webinar is going to be on Tuesday of next week. It will be featuring Dr. John Chen from Evergreen Herbs, and the topic will be post-COVID syndrome, vaccinations, and TCM. So don't miss it. You can register on our blog. I just want to thank everybody for taking their time to spend with us tonight, and I really want to thank Dr. Bishop for such a wonderful webinar. We cannot wait to work with you again.
Thank you so much.
Well, thank you, everybody. Have a great night.